Hi, I'm Dr. Sakina Davis.
And I'm Rhonda Catterhagen, the Nutrition Educator.
Today we're going to be talking about gut health for Wellness Wednesday.
So I have a few questions. How do I know if I have a gut issue? Like, what symptoms would I expect to experience?
So the common symptoms that we see are things like bloating, indigestion, reflux. We can actually experience joint pains, fatigue, brain fog, headaches. So there's quite a variety, but typically most people relate what happens actually what they feel, which is usually that bloating and that indigestion and just not feeling good after eating.
Great. What are some of the common illnesses that you treat?
So we offer a functional approach to treating conditions like ulcerative colitis, Crohn's disease, irritable bowel syndrome. Irritable bowel syndrome is very interesting to me because I want to know what's irritating the bowel. You know, that's a diagnosis that doesn't tell us very much, but we really explore more in depth into what exactly is irritating your bowel so we can try to get that under control for you.
What type of testing do you have available?
So we have some excellent testing for food allergy testing, but more importantly for food sensitivity testing. So most people don't actually have allergies to a lot of the foods today. We have really realized that in the United States specifically, we have a lot of genetically modified foods, we have pesticides in our foods, and so food is not bad, but what we've done to food has really irritated our bowels. We eat a lot of things that our body doesn't even recognize as food anymore, and so why it's really important for us to figure out what it is that's part of that food that's irritating your gut.
The junctions in your stomach lining not doing their job, keeping our food where it should be, but rather leaking proteins into our blood system and causing immune reactions within our body. And it sounds like it's more related to the gut, but it actually affects a person's whole well-being.
Can you tell me more about the gut-brain connection?
Absolutely. So we also offer a functional approach to treating anxiety, depression, attention deficit disorder, because we now realize that there is a gut-mind connection. So if we don't really clean up the gut and find out what's causing inflammation there, we're going to have a much harder time trying to really treat that depression and anxiety. So by trying to find out what you're sensitive to, what you are causing inflammation, and removing those foods from your gut and replacing with good probiotics and enzymes, we're really able to help clear out the gut, which hopefully will help either medications that you're taking, supplements, lifestyle changes, ways to address anxiety, depression, and attention deficit disorder.
Good. How and where do you incorporate a nutrition educator in your practice?
So it's really important to me that we have somebody who's going to be able to coach you, to help you, to take you to the grocery store. And we love that about Rhonda because she's able to take you, show you exactly what you should be shopping for, how to read a label, what's important about grass-fed beef, why should I eat, free-range chicken, what are these things? So, I really thought it was important that I bring in somebody who can advise you and coach you and help you through the nutrition changes that we recommend. And Rhonda is just amazing at that.
Good. So what is leaky gut specifically, and what do I do if I have leaky gut?
So leaky gut is a condition where the lining of your intestinal system allows for the leakage of proteins and other undigested foods into your general circulatory system. That doesn't sound like it's going to be hugely problematic, except for the fact that our bodies don't recognize those undigested proteins or other undigested foods as our normal breakdown of nutrients. And so that causes a myriad of problems in a lot of folks. And that can often look like inflammation in your joints. It can cause rashes, it can cause hives, it can cause bloating, it can cause brain fog, it can cause abdominal pain, and people can come with other symptoms that often track back to this leakage into their circulation. So leaky gut in general is something that we tend to take and treat over the course of months. It's not something that we can look at and fix within a week or 2 weeks, and it often involves more than just lifestyle or nutritional changes. I will say that by removing some of the common disruptors in our diets that tend to be responsible for this gut leakage, things like dairy, things like modern wheat, things like alcohol, or a diet that's high in sugar, often just removing those items tend to give our system and our immune systems a rest from having to respond to all of these offenders by way of inflammatory responses. And so along with taking those foods out of our diet, we want to replace them with healthier versions that are going to provide us with more nutrient-dense responses. And some of those things would include healthy fats, so avocados and some of the nuts and some olive oil and olives. We definitely want to increase our intake of vegetables, and certainly the micronutrients that are in vegetables are going to be used much more efficiently and in a healing way than some of the foods that we have removed. We also maybe want to include some raw dairy. Raw dairy does not have the pasteurization that destroys the enzymes that help us digest. So certainly if you have the ability to get some raw dairy into your diet, that would be helpful. Looking at things like bone broth, and bone broth is all the rage for hair, skin, and nails, but I think sometimes we forget about the benefits that we can get to our gut from drinking bone broth. Properly made bone broth certainly is rich in some of the amino acids that are definitely directly impactful in helping us have a healthy gut lining. Along with the nutritional changes, we also like to incorporate things like digestive enzymes. Sometimes our own bodies, unbeknownst to us, don't produce the levels of enzymes to digest proteins, fats, and carbohydrates. And so what happens is we can be eating the best of the best organic foods, and we don't have the enzymes onboarded in our own body to be able to break them down into a usable form. So we definitely complement our treatment of leaky gut with some supplemental digestive enzymes. We also use healing agents. So we're taking the inflammatory agents out of the diet. We're using a concentration of healthy foods and nutrients back into the diet. We're providing an environment in which we should be healing that gut lining, but we also want to add in some supplemental healing agents by way of herbs and other organic compounds that are going to help us with the healing. We also like to use probiotics. So if you think about this in order, we're going to remove the offenders, we're going to bring in the defenders, we're going to bring in some of the agents that are going to help with the healing, and then we want to maintain that environment once that leaky gut and those junctions are closed by way of repopulating our gut with probiotics. And here at the office, we have a broad variety of probiotics that we use. Certainly, we don't cover all of them. Our guts are full of hundreds of them. But the idea is to target the gut with as much repopulation of healthy organisms that we can, which in turn will provide us with an environment in which we are going to better absorb all the food and the nutrients that we take in on a regular basis.
That's great information, Rhonda. And we do actually have a microbiome test that actually can determine what levels of probiotics you have, good bacteria, bad bacteria, if there's fungus, bacteria, parasites, other things. So we can also address those things as well. So hopefully that was a good discussion about information for gut health. Thank you for tuning in today.